So what you see here is what the Rultract equipment is going to look like in the basket after it's been removed from the tray. Needless to say, this can be overwhelming to a scrub tech or a scrub nurse the first time that they see it. So what I'd like to do is try to organize this a little bit so when the surgeon calls for the Rultract, we are able to find the pieces that we need to set it up and to move forward with the procedure. A lot of times, sometimes sterile processing will have this a little more organized, but most of the time they don't understand the equipment, so of course they just put it in the tray like you see it here. So what we need to do is organize it so it's easier to set up. Now keep in mind that this equipment is used most of the time, depending on the procedure of course, but most of the time this is used for ReSternotomy, so this is going to be used at the very beginning of the case. So when the surgeon's making the subxiphoid incision, just prior to that we could be organizing this. If you have room, I would pull the larger pieces out and set them aside. Your clamp, which is going to be the first piece that goes on the table, go ahead and set that aside. And then your bottom post, which goes on next, and then your top post, which goes on after that. And just go ahead and set those aside. If you're able to find room for them, it's going to be easier when it's time to set up if they're all sitting outside of the tray, obviously. Now I'd like to organize the remainder of the pieces. Something that you have to be aware of is all of these rake tips, and there's a lot of rakes in here. All of these rake tips are very sharp. I know you're used to working with sharp instruments. I'm just letting you know that in this tray there are plenty of sharp tips. Now we have 4 different sizes of the ReSternotomy retractor, from the smallest, which are referred to as hooks, to the largest, which are just called large. And I like to organize them from smallest to largest. So I put the hooks, then the small, then the medium, obviously, and then the large. And you will be able to see the difference in the rakes. As you look at the tray, it's very obvious. And also each one of the rake plates is stamped. You'll have RDL for large, RDM for medium, RDS for small, and I believe the hooks are just marked RDH for hooks. So if you can, organize them like this, and then take your rotating extender bar, set that down so you're able to access it easily, and also your ratchet assembly. So now this tray is better organized and we are ready to set the Rultract up for the procedure. Now that we have our equipment better organized, we're ready to set the Rultract up when the surgeon's ready to use the equipment. So the first piece that you're going to take will be your table clamp. Now this table clamp, depending on OR protocol, we can either go over the drape or we can go under the drape. So if we go under the drape, you go ahead and lift that drape and go up underneath to find the proper positioning for this clamp. So what I would do is feel for any obstructions or lines along that rail, and then find a space in between the bolts that hold the rail on, and go ahead and put your clamp on. Now to put the clamp on properly, you'll want to turn this knob counterclockwise enough so that the jaws are open wide enough to put it on the rail. Even wider if you're going to go over the drape, obviously. So you'll put your top jaw on the rail and then rotate that clamp in while squeezing the jaws together. And you may not be able to see this if you're under the drape with your hands under the drape. So you go ahead and pull, squeeze the jaws together. You'll hear them grab the rail. Now you're going to want to squeeze the jaws together and hold the jaws together and then turn your knob. You don't want to bring the jaws together by turning the knob. You won't get a good purchase on the bed rail. So go ahead and squeeze them together. Make sure that you're on the rail securely, and then tighten the knob. And be careful not to get your glove stuck here between the knob and the jaw. So go ahead and tighten that just as tight as you can get it. Once the clamp has been put onto the bed rail, we're going to have to put the bottom post in. So if you are under the drape, there are 2 ways this can be done depending on OR protocol. We can cut a hole in the drape and drop the post down into the hole, Or, of course, we can move the drape out of the way, put the post in, and then drape around it. But for the purpose of the video, we're just going to move the drape out of the way. So when you put your bottom post into the clamp, this is very important. We have to make sure that the bend in the post is in the superior position. So when you go ahead and put that post into the clamp, you have to make sure the bend is going this direction, because this bend is designed to give the assistant additional work space. And if it's not set up this way, the retractor will not set up properly over the table. So go ahead and put your post into the clamp and then tighten your wing handle. Now this doesn't have to be tightened as tight as you can get it. Just turn it so it makes contact. That helps keep this bottom post more stable. Now I would suggest draping around the post if that's what your protocol calls for. We are now ready to put the top post onto the bottom post. Now you can see here that this continues the same geometry to allow for the additional workspace. In this situation, we want to be sure that the bend is going in the inferior position. So go ahead and put your top post onto your bottom post, and you can see that this workspace is maintained. Now the top portion of this top post goes in the medial position directly over the center of the sternum. After putting the top post into position, grab the collar and rotate it to be sure that it's properly seated. It should not rotate if it's on correctly. We are now ready to add the rotating extender bar to the top post. Now the first thing that you're going to do is to open your lock knob all the way. So you turn it counterclockwise all the way until it stops. Now this lock knob is designed to securely attach your rotating extender bar to the top post. When you put the rotating extender bar on, if you put it on with the tightening knob on the top, you'll gain an additional 2 inches of height over the OR table for large patients. If you have a medium to a small patient, you're going to want to put it on with the tightening knob on the bottom, because that brings the retractor closer to the table. Another thing to note is you want the lock knob in the superior position. You do not want this lock knob over the center of the patient, because the surgeon may bump their headlight on it. So go ahead and slide your rotating extender bar onto the top post. I usually put it on at about the 3rd or 4th detent. So you find your proper position and go ahead and secure that lock knob into the detent. And you can see here, this will give you an idea of how to position the rotating extender bar to be sure that you are securely locked into a detent. Once you have it in position, go ahead and tighten the knob. We are now ready to add the Rultract ratchet assembly to the rotating extender bar. Now, something very important to look for when you take the ratchet assembly out of the tray. You can see here that there is a groove cut into the gearbox and a pin inserted into that groove. In order for this piece of equipment to function properly, that pin has to be in the groove. Now, because sterile processing has to disassemble this piece of equipment for cleaning and then reassemble it for sterilization, there may be times when you receive it from sterile processing when the pin is on the side of the gearbox. Now, this can be fixed in the field. I would do it over a tray in the event that you drop the spool cap nut. So all you do to fix this is go ahead and hold it like this and then loosen that spool cap nut. You only need to loosen it just enough to be able to pull that pin back and slide it into position. And then insert it into the groove and tighten your spool cap nut. And tighten that as tight as you can get it. Make sure that that pin is in the groove. We are now ready to add the ratchet assembly to the rotating extender bar. So after we've already checked the pin to be sure it's in the groove, we're going to want to open the lock knob by turning it counterclockwise all the way until it stops. Then when you put the ratchet assembly onto the rotating extender bar, make sure that the handle is in the superior position and that the cable and the spool are over the patient's sternum and the incision. So go ahead and slide that on. I usually position it at about the second or third detent, depending on patient size and surgeon's preference. And you can see here that when it's properly aligned, it is directly over a detent. You can see there's a very small gap here, and that shows you that you are in a detent. If you are not, if it's not properly aligned and you try to tighten it down, you're going to have a significantly bigger gap. So that will let you know that you are not in a detent. So go ahead and readjust it and secure your ratchet assembly to your rotating extender bar. Now we are ready to add the final piece, which is the ReSternotomy Attachment. Of course, the surgeon is going to call for the ReSternotomy Attachment or for the retractor, and may or may not specify a size. So you may have to ask what size, or of course the surgeon may be well aware of what they want and say, hand me the medium. So just look into the tray, and if you have the tray properly set up, finding the medium retractor is pretty simple. And if you don't, just look for the medium size rakes, and also remember it's stamped RDM for medium. And then I think at this point the surgeon would go ahead and snap that onto the snap clip. Now I will explain how to manipulate the gearbox, how to lower the retractor and to retract and to raise the retractor. As far as spreading the rakes go, it's pretty self-explanatory. Rotate the knobs one direction to open the rakes and a different direction to close the rakes. Now it's not going to be clockwise or counterclockwise, obviously, because this is going to spin. So you'll just see and feel which direction the rakes are going when you're moving the knobs. Now for the purpose of this video, I've turned the ratchet assembly around so we could see the handle and the ratchet reverse lever. So when you're ready to lower the retractor to the incision, you can do it one of two ways. Of course, you can lower the snap clip to the incision before you put the retractor on. And what you would do is try to pull the cable down. If it doesn't come down, you're going to switch your reversing lever to the opposite side and then go ahead and pull the snap clip down. Then at this point, you can attach the retractor to the snap clip. Of course, the other way is to attach the retractor to the snap clip and lower them both together at the same time the same way. You're going to try to pull the cable out. If it doesn't come out, switch your reversing lever to the opposite side and slowly pull the retractor down to the incision. Now, in order to retract, once you have the retractor in position, you're going to turn the handle. It's not always going to be clockwise or counterclockwise because the reversing lever will manipulate the retractor in one direction or the other. So as you can see here, I'm going to try to retract. The handle does not turn this way, so I'm going to turn it in this direction and I can retract. Now it locks into position. So if you want to lower it, what you need to do is to move your handle slightly in the direction it will move. You can see it's locked into position here, so it's not moving this way. So you're going to move it in the direction it will move. Don't let go of it. Switch your reversing lever to the opposite side and then slowly let the retractor down. Now when I do this with weight attached to the snap clip, you'll see what the importance is of keeping your hand on the handle as you lower the retractor. So now we're under a little bit of weight and tension. So if you were retracting the incision and you wanted to adjust the retractor, you would have to lower it in order to move it in the incision. So what you would do here, what you don't want to do is to just move the lever to the opposite direction because it will drop. Usually you don't have this much weight on it, but you get the idea. So you go ahead and retract once again, and then you need to adjust the retractor, so you're going to want to reduce or eliminate the tension on this cable so you can reposition the retractor. So what you do, again, this is only going to move in one direction at this point. You can see I can't move it in this direction. So I'm going to move it in a direction it will move. And while holding the handle, I'm just going to switch the lever to the opposite side. Don't let go of the handle. You slowly lower the incision. And then you can continue in the same direction to retract. Now it does look a little more difficult than it is. It's very intuitive once you start using it. So one last time. We're retracting by turning the handle in a direction it will move. I'm making it look more difficult because I don't want to stand in the way. Now I want to readjust the retractor, so I need to lower the retractor and reduce tension on the cable. So I'm going to turn this in a direction it will move. It only is going to move in one direction, and you will feel that. So I can't move it this way. I'm going to move it in a direction it will move. I keep my hand on the handle, move the reversing lever to the opposite side, and slowly lower the sight. And that's all there is to it. So now the retractor is set up and ready for use, and you have an understanding of how to use the reversing lever and the crank handle. If you have any questions, obviously feel free to email or call me. Thank you for watching the video, and thank you for the continued support. Have a good day.